Hello, good afternoon. My name is Dr. Fariah Gaba. I am a British dentist currently working in The Hague in the Netherlands, as part of the Best Researcher Award. I am going to present to you all my research on the role of oral Fusobacterium nucleatum in female breast cancer. I would also like to state that I carried out this research with two other colleagues, Drs. Raquel Carcelin Gonzalez and Dr. Raquel Gonzalez Martinez, both of whom are university professors at University Cardinal Herrera in Valencia in Spain. Before I begin, I would also like to state that this article has been published in the International Journal of Dentistry. Please refer to the website link below for further information. Okay, so to begin this presentation, I'd like to give a brief overview of its contents. I will first start to talk about breast cancer in general and state some very important facts. I will then go on to explain the enigma of oral Fusobacterium nucleatum, periodontitis, and female breast cancer. Following that, I will discuss some periodontal surgical techniques. Afterwards, I will discuss briefly about cancer progression, purpose, then go on to the methods, results, conclusions, finally acknowledgements, abbreviations. Okay, so first I'd like to begin to talk about breast cancer and some of the facts. Breast cancer is the world's most prevalent malignancy. In 2020, over 2 million women were diagnosed with breast cancer, leading to approximately 684,996 deaths worldwide. 1 in 8 women from all ethnicities will be diagnosed with breast cancers during their lifetime. However, numerous treatments are available, such as radio and chemotherapies, anti-cancer medications, hormone and biological therapies. Despite international efforts in outreach programs, frequent testing in women above the age of 40 years, and research into cell signaling pathways, breast cancer incidence is on the rise. Now, I'm going to discuss about the enigma of oral Fusobacterium nucleatum, periodontitis, and female breast cancer. Recent attention has been drawn to the significance of microbes and an association between disruptive microbial homeostasis and breast cancer. The oral environment contains particular oral habitats, such as the hard, non-shedding external surface of human dentition, the gingiva, and the dorsum of the tongue. In addition to this, the oral cavity is a cornucopia of microorganisms, with approximately 700 identifiable bacterial species that collectively encompass the oral microbiome. When this very delicate intraoral environment becomes overburdened with dental plaque accumulations, this causes microbial imbalances, or as we like to call it, dysbiosis. This in turn leads to acute inflammatory responses, which instigate gingivitis or inflammation of the gums. Accumulation of dental plaque over prolonged periods of time can instigate chronic inflammatory responses, as previously mentioned. This leads to periodontitis. Periodontitis is a rife disease associated with both microbial dysbiosis and inflammatory responses, affecting approximately 45 to 50% of the adult population above the age of 30 years of age, and more than 60% of people aged over 60 years old are also affected. Periodontitis is characterized by a loss of connective tissue attachment, gingival inflammation, alveolar bone resorption, and a loss of dentition. Unlike other infectious diseases, periodontitis is caused by bacteria from within the oral cavity and accelerated by an increase in microbial biomass, as opposed to compositional alterations within a specific bacterial community. This premise occurs with an apparent increase in bacterial load, and so periodontal disease, in murine models and in humans as they grow older. During the progression of inflammation in patients with periodontal disease, a multifunctional molecule, namely endothelin-1, is overexpressed within the human body, secreted by endothelial cells after exposure to pathogenic bacteria, and is a dominant vascular inflammatory mediator. There has been recent speculation that a combination of chronic inflammatory markers associated with systemic diseases, certain oral bacteria, and their byproducts leaving the oral cavity and infiltrating the systemic circulatory system could help accelerate cancer progression to distant bodily sites. And our study identifies Fusobacterium nucleatum as being one such vital virulent pathogen. Now, reports have stipulated that serum pro-inflammatory cytokines, such as interleukins 1, 6, and 8, are responsible for the upregulation of endothelins, such as endothelin 113. I'm now going to go on to proceed to discuss very briefly about periodontal surgical techniques and how they are combating periodontal disease and breast cancer progression. Over time, innovative periodontal surgical techniques have come into play with the purpose of slowing or arresting periodontal disease progression and regenerating lost periodontal tissues. Several flap surgical designs have been proposed with modifications to minimize periodontal surgical trauma. Traditional methods to access flap surgery and flap reflections of buccal and lingual or palatal remains the advocated surgical procedure for pocket reduction or pocket elimination. Now, this is where minimally invasive surgical procedures come into play. MIS is a novel approach that aims to respect hard and soft tissues via minimal flap reflections, thus reducing postoperative pain, encouraging primary healing, and improving clinical outcomes. Since the year 2007, the single flap approach, or commonly known as SFA, has been modified and evolved to better suit a more minimally invasive surgical technique, or MIST, for periodontal disease causing osseous defects, with the purpose in minimizing surgical trauma. A 2013 study reported minimal bone loss when utilizing the MIST approach compared with conventional surgeries. The single flap approach permits flap repositioning and attachment to the undetached papilla, thereby inhibiting contamination by blood clots and reducing postoperative gingival recessions. This in turn reduces the risk of stimulating periodontal disease initiating bacteria by upregulating the pro-inflammatory cytokines, namely the interleukins 1, 6, and 8, and endothelins, which enter the circulatory system and travel to distant anatomical sites, potentially instigating breast cancer pathogenesis. Now, what was the purpose of our investigation? Primarily, there were 4 very important points that our article and our research aimed to concentrate upon. Number 1, namely to highlight the evidence and understand the impact of oral Fusobacterium nucleatum species and their link to breast cancer pathogenesis. Number 2, searching deeper into a connection between endothelin molecules and oral Fusobacterium nucleatum species and their respective roles in inflammatory cytokine activation, periodontal disease, and breast cancer pathogenesis. Thirdly, to appreciate the role of oral Fusobacterium nucleatum species in breast cancer pathogenesis and to recognize their potentiality as possible biomarkers for female breast cancer. And finally, and most importantly, to raise awareness of the complex interactions of oral bacteria, inflammatory cytokines, which could aid as a novel approach for therapeutic targets, and thus result in improved periodontal disease and breast cancer prognoses. So, methods. How we went about our research was to first we decided to do a systemic search in the Central Register of Controlled Trials, Embase, Abesco, NCBI, and Medline databases. This was undertaken from the 1st of January. This was undertaken utilizing articles which were published between the 1st of January 1983 to the 31st of March 2022, inclusive of those dates. Articles included were in English and based upon women between the ages of 18 to 96 years with confirmed gingivitis or periodontal disease and breast cancer diagnosis from registered specialists. Authors, namely ourselves, we extracted data independently, and a meta-analysis of risk estimations measuring associations between oral Fusobacterium nucleatum species and female-specific breast cancer was elucidated via calculated relative risks and 95% confidence intervals. I'd like to just briefly show you all the Prisma flow diagram, which was constructed by us, outlining the processes involved in preparation for this review. As I stated at the beginning of my presentation, for further details and for a closer look at this Prisma diagram, please do refer to our published article in the International Journal of Dentistry. I'd briefly like to go over the results, which I am showing to you all here. Figure 2, this is a summarization of the overall results of articles included within one of our analyses, namely the axis analyses. Okay, and what we can conclude here is that our axis tool showed that 78.7% of examined articles demonstrated a link between oral Fusobacterium nucleatum and female-specific breast cancer. Secondly, and the second most important point to take away, is that breast cancer risk does increase with high levels of this bacterial species due to gingivitis and or periodontitis. So to conclude, the 5 main points that we can state are: there is a strong implication of a significant relationship between oral Fusobacterium nucleatum species and their role in female-specific breast cancer pathogenesis. Number 2, there is potentiality of oral Fusobacterium nucleatum species being utilized in the future as potential breast cancer biomarkers. Number 3, this raises the awareness of the intricacies of this relationship with respect to adult female populations. Number 4, there is a possibility to help reduce or prevent breast cancer development worldwide. And number 5, this presents not only the scientific community, but also the medical communities with the opportunity to transform future prognosis and diagnosis of breast cancer, and also helps raise awareness to dentists that thorough dental examinations are vital for breast cancer survival and would thus increase survival rates and also identification of breast cancer within periodontal disease presenting young female patients. I'd like to end with some very sincere acknowledgements to my wonderful co-authors, Dr. Raquel Gonzalez Martinez and Dr. Raquel Carthelin Gonzalez. We did this work with a great amount of effort, and I can honestly say that I would not have been able to release such research into the scientific community without the help of these two wonderful professionals. So thank you very, very, very much for your contribution to this vital piece of work. Here are some of the abbreviations that are utilized in our research, and as I stated, please do refer to our published article for more details. I'd like to thank you all for listening to this presentation, and would also like to add that I have published, as part of a book chapter in a book entitled Research Developments in Medicine and Medical Science, Volume 4, this article. So the book chapter does add some more detail, and as I stated, if you all are interested, please do buy the book. It is available online as an ebook or as a hardback and paperback copies. If you would like to buy this book, please do refer to this website I am highlighting underneath and do order copies. I can honestly state that all monetary funds from the purchase of this book, whether it is an ebook or as a hard copy, will go towards further research by myself, Dr. Fariah Gaba, as I am strongly and incredibly passionate about oral health and also its link with female health. So I would like to utilize any funds from these purchases to go on to fund further research and hopefully make a difference to society worldwide. That is the goal, that is the ambition, and with your help and support, I will 100% make that a reality. Thank you very much for listening to this presentation. I'd like to thank Pencis for this very prestigious award, and all I can say is it is truly humbling, and I will continue to do my very best to help others and also to inspire the youth and younger generations, as they are our future, and I would love to inspire and teach others to carry on and do good work. So thank you once again.